my name's John VonRosenberg. Most people call me VonRon, so feel free to do so. I'm a flight paramedic with Air Methods. This talk is called Fighting in the Shade. It's about cognitive reframing, which is, if you were here for Dan's talk earlier today, has a lot of overlap with that. It's essentially about choosing your attitude, creating a narrative, and then seeing it through to positive end results. So there's that. This is built on the Battle of Thermopylae, if you're familiar with history, ancient Greek history. I know there are a lot of Greek history buffs in here. Made pretty famous by the battle, or the movie, the Battle of the 300, or just 300, where you had 300 Spartans against a whole bunch of Persians. We'll get into that later, but I say that because last conference in Boston, I dressed up, and so then this one, they said, well, it's about the Spartans, right? You're going to dress up like a Spartan. I said, maybe, and they said, no, you won't do it. I said, maybe I will, so. Super cheer. Just give me some tone loc and I'll really break it down. Okay, so here we go. Battle of Thermopylae with the 300 Spartans. If you're not familiar, this was about a small group of Greeks, Spartans, who were defending their land against insurmountable odds. Over 100,000, depending on what you read, but somewhere over 100,000 Persians were coming in. And these 300 Spartans were tasked. They decided to defend their own area. And one of the Persians came up and said, it's basically hopeless. You know, there's no hope here. There's no way that you can possibly survive, much less win. He made the point, a relatively famous quote. He said, there's so many of us that when we shoot arrows, our arrows will block out the sun. And his response was, then we will fight in the shade. And that's kind of the beginning of this story, where when faced with insurmountable odds or some crazy challenge, rather than just giving up and accepting defeat, you change that narrative and you take it into something positive, like fighting in the shade. Any Army guys in here? It's also the motto of the 1st Artillery Division, I think, something like that. So there you go. Story time. Cognitive reframing. August 26th is an important date for me. It might be important for you guys too, but probably different reasons. August 26th was the day that my most recent base closed its doors. And you say, oh, well, it must be a horrible base. No, it was fantastic. Look, the rainbow ended directly on our aircraft. So it was obviously an enchanted base, and yet somebody decided to close it for some horrible, inaccurate, bad reasons. Anyway, this left me in kind of a bad place. One base closure is bad. If you guys have been through a base closure, you know it's not a pleasant experience. I have had the circumstances, good or bad, of going through 3 now. I'm 3 for 3, so you can call me the base killer. I don't think that's a good thing, but it is what it is. So anyway, after this, after August 26th, I was left trying to figure out what to do. I had no idea. I relocated relatively recently, trying to figure out life, and this was a pretty bad hit that I didn't get up from right away. I had some friends actually brought up this talk, which I had already started working on, and they said, aren't you giving a talk about this kind of stuff? Like, get your act together. I'm like, you know what? You're right. And so I did. I got up, brushed the arrows off, and maybe here I am fighting. By the way, if you're hiring, I'm looking for a job. So this started a long time ago. This is a picture of Rosemary Rowe. She's one who taught me a lot of what I know about flight. And as an example, one of my first days flying, I started flying in July, which is closely followed by August, for those of you calendar guys. And July and August in Charleston, South Carolina are insanely hot. And so there I am, new guy, never been in a helicopter before. It's really hot, and that makes it rather uncomfortable. And the pilots are breaking in the new guy, right, me. So they're pulling pitch maybe a little bit stronger than they have to. They're banking maybe a little bit harder than they could. And all I can think about is like, where is my stomach so that I can tie off the top of it and not just puke all over the back of the aircraft. And in the middle of this, I look over at Rowe, and she's sitting there with a big smile and 2 thumbs up, and she says, "Isn't this fantastic?" And that was my first lesson in cognitive reframing. So she takes a difficult situation and just completely turns it around, focuses on the positive, and that really opens up a whole lot of doors in terms of neurochemistry and resulting hormonal response, behavior, outcomes, things like that. Because what we want to do is function at this high level. Stress is a normal thing. Our body responds to stress in positive ways to a certain extent. And then on either end of the curve is not so positive. So on the one side, probably where you are right now, is sort of this left-hand side of the curve, where you're all really chill. You're all just kind of hanging out. If something were to happen right now that required you to increase your response, something super stressful, it might take a little while for that to happen because you're over on this side of the curve. Up in the top, that's where we want to be. That's where hopefully a lot of us function. Stress is a normal response, and so our bodies respond positively towards that. We're able to do certain things when we find ourselves in a stressful environment that we otherwise are not able to do. On the other side of that curve is what happens sometimes when we're overwhelmed. So we're not functioning at a high level anymore. We're just swamped. We're completely overwhelmed, and we're kind of in that give-up stage. So this is kind of about how we pull ourselves back from that other end of the curve and stay up at the top of the curve where we're all functioning on all cylinders. So this talk, a little bit about training, a little bit about education, a little bit about performance, and hopefully it'll change the way you work here by the next 15 minutes. So stress inoculation is a relatively well-known term. If you haven't heard of it, it's basically the theory saying that you inoculate yourself against stress. You give yourself low controlled doses of stress, and your body learns how to cope with that. And that's a thing that actually happens. It has to be controlled. It has to be low doses. If you repeatedly expose yourself to high stress, you get burned out. So that's no bueno. But the low dose is a good idea. It's all related to hormones. So you have certain neurochemical things that are happening. You know, your body senses an input. It interprets that as stress, and then it releases whatever it needs in order for you to accomplish what your body assumes is going to be the goal. This is that fight or flight thing that a lot of people talk about. With stress inoculation, the interesting thing is that doesn't change. So the amount of hormone released after, if you compare it before and after your training, your stress inoculation training, it's the same. You don't diminish the amount of cortisol released or the amount of adrenaline released. You just change the way your body responds to that. All right, that goes along with this guy, what we are, what we repeatedly do. My old basketball coach used to say, practice makes permanence, not perfect. And he was wrong about a lot of things, but he was probably right about that, in that what we do, what we practice is what we will do in a performance situation. We'll get more into training later. Okay, if you want to talk more recent history as opposed to like ancient Greek history, here's Hebb's law, or Hebb's theory is probably a better word for it. And it's essentially saying that the more you do something one way, then those neural impulses get trained to function together. So if you begin to associate stress with high performance, you'll be a high-performing individual under stress. If you associate stress with negativity, if you encounter a stressful situation and you shut down, that is what you will continue to do in the future. So Hebb's law says that the more you do something one particular way and associate it with the stimulus, the more that'll happen again. If that's kind of murky, gray stuff, think about like a country road. Driving down that road over a car, eventually ruts wear out, and that's where your car drives. It's the same way with your brain. The more you do something and associate it with a particular stimulus, the better you'll do. So here you go. I haven't seen the movie. I'm scared of scary movies. Judge me if you want. But part of this stress inoculation is fear. From a clinical standpoint, that means embracing your fear. So what is it that freaks you out? Clinically, what is it that freaks you out? What are you terrified of? I don't do box babies, like neonates and micropeds. I've never done before. I've never had really good training with that. And so if I were to encounter that, it would be my first time. And I don't know if my performance would be up to snuff on something like that. What we're supposed to do in those situations isn't run away from it or just pack it away and say, oh, well, that only happens, 10 times a year, and the likelihood of me getting one of those is super low, so I'm just going to pretend like it's not going to happen. The point of this training is to embrace that. Step one, identify. What is it that freaks you out? What is it that scares the hell out of you? What is it that you think if you saw it, you wouldn't be able to treat it? Figure that out, identify it, and then create a scenario about it. So don't run away from it. Identify your fear, embrace it, and then work through it. These guys are pretty good at embracing things that aren't normal to most individuals. The military in general is pretty outstanding at putting their people through difficult situations, and they come out the other end. A lot of the research on stress inoculation has been through military. There's actually quite a bit of research on military stress inoculation. There's a decent amount on medical stress inoculation. There's not a whole lot on emergency medical care, and there's nothing on HIMSS stuff. So it's kind of interesting. But one of the interesting things about this theory, this stress inoculation theory, is that it's generalizable. Meaning if you train yourself to respond in a certain way to a stressful stimulus, and we'll assume that's a positive response to a stressful stimulus, then that carries over to other situations. So if you're doing this specifically for medical case scenarios, it'll work best in medical case scenarios, but it'll also work well in any other stressful situation. You'll be able to function better in any stressful situation because the training is generalizable. So it works for military stuff, it works for combat stuff, it works for medical stuff. They've done quite a bit on athletes, professional athletes, and stress inoculation training. Little break, Laird Hamilton. Not that I have a man crush, but if I did, it would totally be on this guy. He is like a waterman's waterman. He is just like next level badassery in the ocean. He used to ride waves that are so big that he couldn't go fast enough. And so he created a special board which included straps because he was getting bounced off the board. It kind of seems to me that would be a self-limiting thing. Like, okay, I can't ride this wave anymore. I'll just get the next one. He put straps on it so that he could catch these mountains like this one. Next thing that he did, some of you guys might be aware of, stand-up paddleboarding. It's been around for a while. He kind of brought it back into the mainstream. So thanks to Laird for that. The third thing is kind of weird. It's foil, which is interesting but obscure and not relevant at all. So we'll just kind of skip by it. But he talks a lot about embracing his fear, about going through a difficult situation and then encountering it, being present in that difficult situation, and then figuring it out to its logical progression. 2002, at this surf break in the Fijian islands called Chopu, which is where this is, and that's not how it's supposed to go, by the way. He's not supposed to fall off the front of the wave. There should be a board, and he should be attached to the water in some way. He and his buddy were out surfing in this break, and they got stuck inside a really big swell. So they were out there in 30-foot waves, and some 40, 50-foot waves came through. And it's called getting stuck on the inside. They got stuck on the inside, and these mountains of water were crashing over them, holding them underwater for minutes at a time. They could only come up just in time to get hit with another mountain, maybe with enough air. And after who knows how long, they made it out. One of their buddies on a jet ski had been watching, waiting for them, found them, plucked them out of the water. Laird and his buddy are both alive. His buddy broke his clavicle, so he was done for the day. Laird, having just gone through this rather intense, traumatic experience, paddled back out, went back out, caught another wave, and then called it a day. But he refused to stop when everything else said, hey, man, maybe we should just call it a day. And that's kind of an example of how this works. You push yourself to that brink mentally, and then you go farther. You know, what happens next? What am I supposed to do next? What else can go wrong with this scenario? Okay, that happened now too. What are we going to do about it? And that's just him holding a ball underwater or a rock. So in terms of our training, that means that you can do this in the ocean. Like, I think that's a great reason to fly to Fiji. You can be like, hey, so there's this thing I learned about at a conference. I'm supposed to go to Fiji and train. But more realistically, it takes place within our arena. So if you're in a helicopter or a truck, either one, you have to be able to do this in your office. So when you do those simulations, you do those case studies at your base, stop doing them at your base. Take that stuff out to the aircraft and do it in the aircraft. Take it out to your truck, do it in the truck. It is generalizable. It will still carry over. This stress inoculation will work no matter where you do it, but it will work best if it is applicable and directly related to your environment. So if you work in a helicopter, your training needs to be done in the helicopter. It shouldn't be on the table in the kitchen at your base. That's not how this works. That's not how any of this works, right? It should be done in the back of the aircraft. Firefighters are really good at this. Any firefighters? Yay, firefighters, yes. They have pre-planning. And if you're not a firefighter, pre-planning is something where they actively go out into their district. They scope out every building that's in their district, and they develop a plan for that building. They know where all the sprinklers are. They know if it has a sprinkler system. They know where the hydrants are. They know where the windows are. They know where the doors are. They know if there's a fire escape. They know where that is. They know where they're going to put their trucks before they even get a call out to that area. And they have a whole book in their station that is basically pre-planning. And then they flip through the book and say, hey, let's go to this address and make sure it's up to date. This is exactly what we need to do medically with our patients. We should have a pre-plan for CHF exacerbation. We should have a pre-plan for massive pulmonary embolisms. We should have a pre-plan for intracranial hemorrhages. And not just in words on a page. This is the protocol for this patient, or this is the guideline for this patient. But you've already pictured in your head what you're going to do. So if I asked you to show me how to pace your patient, could you mentally go through it in your mind right now? Can you put your hands on that monitor mentally, physically, eventually, and say, step 1, turn it on. Step 2, plug in the cords. Experience tells me that pacing works better when the pads are plugged into the monitor. I've tested this, and turns out it's true. So all these different steps you need to be able to do and walk through. What this does from a training standpoint is it frees up your cognitive space. So when you're trying to figure out how to do something, you're able to figure out what's going on with that patient. And you're not trying to figure out how to pace your patient. You should already know how to pace your patient. So free up that cognitive space. Become so good at it that you can just do it automatically. And then when it comes to a super complex, crazy sick patient, you can figure out why they're crazy sick and what kind of crazy stuff you can do to maybe make them better. So free up that cognitive space. This is kind of about creating a narrative. So our CHF exacerbation, what are you going to do for that patient? You create that narrative. You create that story, and you talk about it with your partner. You say, okay, so we walk in, he should be on BiPAP. He should be on these meds. If he's not tolerating that, this is what we're going to do to intubate him. These are going to be the meds that we give. This is what I expect to see based on my history in going to this particular facility or this particular agency. This is what we're going to have to stop because they do this every time. And this is how we're going to fix any potential mistakes. And if he crashes, this is what we're going to do. And then when you're taking care of that patient, you're not figuring this out one step at a time. You've already played this game. You've already done this before. Even if it's only mental, you've already walked through it, and it's just as effective as doing it in person. So create that negative. See that success. Cliff Reed, super smart guy who talked about training cognitive readiness, and that's really what we're doing. Anatomically, physiologically, if there are any huge dorks in the room like me, what we're doing is adjusting the connection between our prefrontal cortex and our amygdala. And you're like, still don't know. Emotion. Emotion is what we're talking about. So particularly the emotion we're talking about right now is stress. So when your body perceives stress, how does the rest of your body, the rest of the stuff that your brain and your prefrontal cortex controls, How does that stress influence your performance in all those other areas? How does it affect motor control, fine motor control, gross motor control, heart rate, pupillary reaction? You can train this. You can change it. And if you purposefully put yourself in stressful situations, you can become better at it. You know, like, I still don't understand what that means. You take the dummy, the mannequin, the simulator, if they'll let you take the simulator, out to the aircraft, you put it in the aircraft, and then you look at your partner and you're like, this is your patient, and you run through it. That's all. You create a narrative of a positive experience where they have to address this challenge. They can't run away from it. This is the challenge, and you have to meet it. And then they do. And then you create a narrative of success. And the next time, it's something else. And the next time, it's something else. And the next time, it's maybe a little more complex. And the next time, it's something else entirely. And you do this on a regular basis so that you become used to this stressful stimulus. And stress is no longer associated with negativity and shutting down and emotionally overwhelmed and just feeling completely swamped. Stress is now associated with your success and your high performance. And that's where you want to be, at the top of that curve. You don't want to be either one of these guys. I'm pretty sure that at least 3 out of the 4 are me, and this poor little guy on the bottom right is about to get taken out. Yes. Which is what happens. You and your partner's freaking out, and you're over there like, hey, so how about some clean towels? Why don't you go out to the aircraft and get some clean towels? And they're like, we don't have any clean towels. We're like, well, then go look for some fallopian tubes. Or shoreline, back to the beach reference, go look for 100 feet of shoreline. Anyway, if they stay in there and they keep running on that hamster wheel, eventually they're going to take you out too. So don't let that happen. Work with your partner on this. It's super, super important. So, develop a plan. You can't do it for all of them. It's impossible. I'm not saying that you can have every patient in your little mental Rolodex that you will ever encounter. That's ridiculous. But you can have a lot of them. You can have them for your MIs, for your STEMIs, for your non-STEMIs. You can have them for your CHF. You can have them for your trauma. You can have them for your neuro. Take some of your big ones and run through those patients all the time. Get your hands on your pump. Get your hands on the IV monitor. Get your hands on the laryngoscope. Hands on the ventilator. And practice these patients. Cognitive space available. When you create these narratives, then you're no longer mentally consumed with the details of a particular plan. You're able to do the plan and then think of something. When I was on the truck, the perfect time for me to do this was walking with the patient from the house to the ambulance. On a helicopter, sometimes it works out, sometimes it doesn't, but there's a break between, on an interfacility, from the facility and your aircraft. You're not doing anything. That's the time when you think. That's the time when you figure it out. Hopefully you figured it out before then, because at that point you're a little ways in. But if you haven't, that's the time when you do it. So get used to your equipment so that you can just have the equipment do what it's supposed to do. And then your mind is free to critically analyze what's going on. You're synthesizing information here. You're taking an input from a whole bunch of different sources. What's the nurse say? What's the patient say? What's the patient's family say? What's the doc say? What's the rad tech say? What's the ABG say? What do your current vital signs say? Are they remotely close to what they were 5 minutes ago or what they were reported to be 5 minutes ago? And you can take all this and analyze it. If you're so worried about, like, my EKG cables aren't picking up an EKG or the pulse ox pleth is shit, then you're not critically analyzing your patient. You have to be able to do all that and then create cognitive space for you to figure out what's going on. Look for opportunities to act. This is kind of a big one. Patients need help, and we're there to help them. Sometimes the answer is do nothing and just transport them quickly. But a lot of times the answer is to do something to dramatically alter the course of their care, hopefully in a positive way. That's what we're supposed to do. We have to identify that and then be willing to step out. And then resilience is seeing it through to the end. There you go. So, train cognitive readiness. Decide to act in advance. Don't be that guy who's halfway through a code and then you're like, hey, let's do chest compressions. Like that, you should have already decided to do that and probably should have already been doing it. Trust your partners. Rely on these narratives that you create. Allow for cognitive space. And then there's this neat little quote about experience. I've been talking a lot about mental ideas and picturing things, and all that's like really abstract. And I don't pretend to think that that takes the place of everything else, but it does to an extent. The rest of it is filled in by experience. So you have this knowledge and you have this performance. Experience is the link between those two. So if you're not, if you're a third-year nurse or fifth-year nurse, or maybe you just started flying and you just happen to wander into this conference room, your experience isn't there yet. You create that experience yourself until the experience comes to you, because that's kind of a self-limiting thing. My DeLorean is busted, the flux capacitor is all jacked up. So I can't go forward, gather all my experience, and then come back. Like, this has to happen on its own. And in the meantime, you create that experience. Maybe then you'll be able to do something like that, which is crazy. Quick shout out, podcasts. These are fantastic. I get a lot of my ideas from these guys. And if you don't, you totally should. So do that. And this was just a clip from the movie. Totally no copyright infringements here whatsoever. And that's me.